Hi class. I think we can all agree that nursing is a career unlike any other. One moment you can be holding the hand of a dying patient, while the next have a patient complain because they have not received their pain medication yet. Regardless of situation, it is imperative for nurses to establish a caring relationship with their patients and utilize core value concepts in patient care. These concepts include caring, diversity, holism, communication, ethics, integrity, patient-centeredness, excellence, and advocacy. For the purpose of this week's discussion, I will review the core value of holism and its relationship with nursing. According to our nursing handbook, holism is the concept of caring for a patient as a whole, noting their unique characteristics such as religious beliefs, culture, societal background, and physical attributes. By unraveling various aspects of a patient's life, the nurse can obtain important information to provide quality patient care. For instance, let's review a scenario that goes against holistic nursing. A patient is admitted to the hospital for shortness of breath and has lab work performed. The results come back and the patient's hemoglobin is 6.5, meeting criteria for a blood transfusion. The nurse has not spoken to the patient regarding their religious beliefs or culture, so the only thing the nurse knows about the patient is their current medical condition. The hospitalist orders 1 unit of blood to be given, so the nurse enters the patient room to receive consent for the blood transfusion. Upon entering the room, the nurse does not introduce herself and looks at her computer while speaking to the patient. The patient becomes upset, stating they cannot accept a blood transfusion as they are Jehovah's Witness. The nurse avoids eye contact with the patient and says she will let the doctor know of his decision while exiting the room. This situation represents inappropriate nursing care and lacks a holistic tone. Upon first meeting, the nurse should have greeted the patient, introduced herself, and asked how the patient was feeling while maintaining eye contact. A detailed collection of information should have been gathered at that time to make sure the patient's beliefs were accounted for in their treatment plan. If this information would have been known, the doctor could have entered the room to further discuss with the patient, rather than the nurse attempting to retrieve consent for a blood transfusion and further upsetting the patient. Patients are often in a vulnerable state when they are faced with hospitalization or medical changes. It is very easy to become overwhelmed as a nurse and lose patience in the nursing process, but it is our duty to form connections with patients and make sure they are receiving appropriate care, not only for their physical illness, but also their mental, spiritual, and societal well-being. Thank you.